Now I would like to invite Dr. Bilal Anwar from the National Disaster Risk Management Fund to give his inaugural remarks. Please.
Bismillahirrahmanirrahim, and very good morning to all of you. And my sincere thanks to Dr. Iqbal Chaudhry, Professor Rahman, and Dr. Wase, and most importantly to all the students of this particular institute and the University of Karachi. Indeed, an immense pleasure to be here this morning, and coincidentally had a wonderful overview this morning. There was a big delegation from NDU, and which actually gave me a wonderful opportunity to learn a lot more about what ICCDS is doing, and the phenomenal work and the excellent work it is doing in cutting edge technologies and the sciences, and how it's contributing into the society. So thank you very much for providing me this opportunity, and I'm immensely happy and delighted to be here. This webinar, one of the reasons actually I'm here, being a very practitioner in the sense of disaster management, disaster risk reduction, disaster risk financing. I think this is extremely important that the academic institutions and the research bodies and the students who are the doers and the shakers of the future basically take the keen interest into it. I think it would be an understatement to say that the whole world is, when it comes to the climate change impacts, it comes to the disasters, the frequency and intensity of the disaster that the world is facing, it would be an understatement to say that we're living in extremely uncertain times. This is not only unique to Pakistan, this basically applies to many other regions of the world and many other countries. But coincidentally, we happen to be right now passing through one disaster, and which of course is in terms of the gravity, in terms of the scale, it is something which has never been unheard, which has never been experienced before. I was talking with some of the friends back in Islamabad, and it's not fully confirmed yet, but I think there is some assessment at the global scale. The international organizations and the entities are doing it, which might come to the conclusion that this is going to be one of the biggest climate-induced disaster when humanity might have seen or experienced so far. Of course, the brain and the mind always goes back to tsunami, but tsunami was an earthquake, and it doesn't really classically fit into that classification. So it is a very uncertain time, and societies, of course, are not really up to march with it in many different ways. And the health sector, of course, being one of those forefront sectors which are exposed to it, which get directly impacted to it, and they get the brunt of the impact and the exposure to it. And then they have this noble cause and the duty of kind of serving the community and be at the forefront once again to provide the relief and the support and the rehabilitation, and it goes across the board. So first of all, thank you very much. I'll be talking a little bit more about it later on, but I very much look forward to the interaction. What you will hear is a very practitioner's view, so not a very scientific or not a very research oriented. But I think and this is the beauty of being here today, is that we are actually able to combine them together and fit them together and gel them together in order to come to viable, implementable, and workable solutions. So thank you very much, Dr. Nimrod. Thank you, Professor Iqbal, and everyone else around. Thank you.
So, our first keynote lecture is by Dr. Bilal Anwar, CEO, National Disaster Risk Management Fund. Dr. Bilal Anwar is an international climate policy and sustainable development professional with a reputation as a leading technical expert, with over 2 decades of diverse experience in the field of climate change. Since 17th January 2022, Mr. Anwar has been appointed as the CEO of the National Disaster Risk Management Fund, registered under Section 42 of the Companies Act to provide funding to the government and non-government entities in undertaking risk reduction activities against natural calamities and climate-induced risks to make Pakistan resilient against disasters. We are honored to have you among us, sir, and look forward to hear what you have to share on this very important topic. Over to you, sir.
Okay, thank you very much once again. And let's get to the business. So I think we had an opportunity of sharing good words and inaugural sentiments. I think the fact remains that, as Dr. Wase said in the beginning, and Nimra, you mentioned as well, right now we are in the middle of a disaster of a very unique character and nature and scale and gravity. Thank you very much. Thank you. So, it's unique and it's different in the sense that it's not a riverine flood, it's not a flood which is coming out of the glacial outburst, which Pakistan has been facing, and in all likelihood, the intensity and the frequency of those kind of floods are also going to increase in the coming years. So the science is very clear, the data is out there, and the predictions are now close to accuracy. So we need to be extremely warned about it, and we need to be extremely worried about it. But right now, what we see, and especially you sitting in the province of Sindh, it's a disaster which came out of the torrential rains, which is the rain outburst. And that basically means that all the preparations with the governments, the different governments from the federal to the provincial levels, they might have been undertaking, and the super floods of 2010, the lessons they might have learned from those floods, they are basically ineffective. They are not really workable solutions anymore. So in terms of the disaster management, disaster risk reduction, I think this put us in a very uncertain situation, and which basically need that all the approaches and the scientific models and the relief, rehabilitation and reconstruction work and the lessons which we might have learned in the last over 10 years, that need to be re-questioned, that need to be reconfigured and redesigned. So, so this is what we are right now in the middle of it, and this is what the governments and everyone else has to prepare for it. Now, the health sector is always a victim as well as the life-saving support out of any disasters. So they are at the forefront, and in Pakistan, we are once again in a kind of a very peculiar situation where the health network and the provisions and these provision of services to the masses, especially the rural people, is not really up to the mark. The government has, over the years, over the decades, they have been doing a kind of a tremendous job in terms of setting up the health networks and the health systems, but the fact remains that it still is very much missing from the vast geographical areas as well as the people who do not have access to it. So in that context, the rather gloomy and doomy context, I think today's exercise and the session becomes extremely important, and I hope we do learn a few things out of it, and we are able to take it forward to somewhere. My own institution, National Disaster Risk Management Fund, is actually mandated to respond to exactly these kind of disasters. Not in the relief efforts. Our mandate and the focus is to work on the disaster risk reduction. So our work actually starts and finishes before a disaster happens, and then we, of course, do participate and do take an active role in rehabilitation and reconstruction work as well. So let's see what is a disaster. This is a very standard definition, and which you can find, and I'm sure that you are extremely familiar with this definition from the literature. It's a serious disruption of the functioning of a community or society involving widespread human, material, economic, and environmental losses, and impacts exceeding the capacity of community to cope with it. I think there are a couple of things, there are a couple of important determinants in this particular definition. The one is the disruption, and the disruption up to the scale which basically which disrupts the functioning of a society, a community at a reasonably large scale. And then the second is the capacity of the community or the large size of the people to cope with it and to manage it. I think if we look back a little bit into the history of Pakistan as well as globally as well, you will see that this definition applies and fits into many of the disasters. The only challenge right now, and the challenge which we are living through, and once again, the research and the science, especially the climate change science, is telling us, is that these determinants are going to become even more critical, and they're going to become even more serious. So the disruptions and the level and the scale of disruption and the frequency of disruption is going to become a lot more critical as well as a lot more severe. And the coping capacity, of course, which is indirectly interrelated with the socio-economic as well as the technological stage of the communities and the society, is of course never going to meet up and never going to match up. So this is a serious kind of a catch-up game in which many societies of the world are living, and Pakistan happened to be in an even more unique situation, as we know that our topographical conditions as well as our socio-economic conditions actually put us in an extremely vulnerable situation. There is this very popular quote, there's a popular saying which basically is being quoted very frequently these days, that the Pakistan is placed at number 5 in the global risk index. This is the German global risk index, and which is based on the vulnerability and exposure of the vulnerability for any country and a society have with the upcoming disasters, which of course is true. So Pakistan have actually graduated from number 8 and number 7 to number 5, so our vulnerability is actually increasing. And I'm not talking about over tens of years of time, it's just in a matter of last few years, which we have actually moved upward in terms of our vulnerability to the natural disasters. So, since it is about the coping capacity, so any disaster is manageable. Of course, it depends on the preparation of it. It depends on the socio-economic conditions and the health of a society and a country. So the disaster management in the literature and in the practical approaches is all about the creation of action plans and implementation mechanisms, which basically reduce the vulnerability. No disaster management plan can completely eliminate the hazards and the risks. And the whole purpose of these plans and the disaster risk management approaches is to minimize the risks and to minimize the impacts and effects on people, on communities, on societies, and of course on the economic systems as well. So, as I was saying early on, that this is a interesting time, because what we are seeing is that the nature and the scale of the disaster is so frequently changing, and is changing at much a faster pace than the societies can really adapt to it. And even if we are able to adapt, I mean, there is a growing literature in the sciences which basically show that which tells us that there's an inherent limitation to the adaptation. And what also we're seeing is that the mitigation actions or mitigation responses are not really up to the mark. And so for a very long period of time, and it's really hard to tell not only in Pakistan, but the many societies around the world are going to remain in this kind of situation, where the disaster management systems, that are disaster management approaches, has to be upgraded. It has to be constantly and continuously to be reconfigured in order to minimize the risks, in order to address the effects of it and the impacts on the large scale. So this is the changing nature of the disaster risks. What you're seeing on my left-hand side, that the figure is actually the disaster risk was much simpler, it was much clearer, and basically has this combination of exposure, vulnerability, and natural hazard. And for a very long period of time, we learned this, and we put up our action plans and our response measures against this very well-established understanding in the literature as well as in the practicalities of it. But what we're seeing is the things are becoming really complicated, and it's becoming really muddier. There are layers and layers which are being added up, which makes the whole disaster mechanism a lot more complex. So the natural hazard is compounded and complicated by the impact of the climate change, and then we know that the poverty, environmental degradation, ecosystem balances, a number of other factors, they of course complicate the picture on the vulnerability side. And now we are also seeing the poorly planned development, and this is what we are seeing, and this we see in Pakistan actually at a much bigger scale, have a direct interlinkages and direct relevance to the exposure component. So what we're seeing here is that the climate change has this kind of interlinkages and cross-cutting impacts, both with the hazards as well as with the exposure. And when they, of course, they are combined together, the vulnerability increases, and it actually exposes societies to a much greater scale to the impacts and the disaster risks. So there is the number of factors which can be added, and it, of course, changes with the different societies, and within the societies it changes with the different population groups and the demographic impacts as well. So we know that the climate change, ecosystem decline, environmental degradation, they are key determinants. If we combine this with the population growth and the development approaches, which we have seen and we have adopted and we have put into the practice, and of course it makes the whole thing very complicated. And similarly with the models of economic growth, which are largely based on the mass scale industrialization, and which of course are based with the underlying understanding that the growth and the development is all about harnessing nature and then fighting with the nature, not really to be homogeneous and to be benign with the nature. So what we are seeing is that the disaster risk is dynamic. It's changing its character all the time, and especially with this the climate change impacts, and which are nothing new. The science community knew about it for a long period of time, and but it has not really made its way and appearance in a very strong way to the policymakers, and now we are seeing the direct impacts of it. So the risk is becoming, it has always been dynamic, but this is since the intensity and the frequency has changed, so that makes it really difficult to assess the risk, and that basically requires a very regular and almost a continuous reassessment. So, I mean, if I look into this, what is going on currently in Pakistan, I think the relief efforts which are being undertaken, I think the relief, and of course, when a large segment of the society, the large size of the population, of course, is becoming is underwater, is losing its livelihood, and there are places to live. Of course, what is immediately needed is their survival kits and their survival support. And I think in this particular disaster, what is going on right now is we are actually walking out of that phase and we're going to the rehabilitation and reconstruction, where actually becomes even more important and critical that all these components, all these areas, and the dynamic mechanism are fully taken into consideration. So. So what is the relationship? What is the relationship, the core relationship between the disaster and health? So, disasters, they impose multiple pressures on the health systems and cause disruptions for providing health services to people. At the same time, increases the risk and exposures to communicable diseases transmitted by water, air, and vector, and further vulnerability and capacities of health systems. So, the health systems, of course, are very much exposed, and they are one of the sector which is the frontline sector in terms of providing relief to the people. At the same time, we're talking about the infrastructure, so they are very much brick and mortar of the people. We're talking about the buildings, we're talking about the facilities, and when any disaster, flood or earthquake or anything else which hits those facilities, of course their capacity to provide their services and to be for people to be accessible to those facilities is threatened, is destroyed in the very first go, and that brings a lot more pressure on these facilities. But then there is on the health side there is a human component of it, and which is also equally important, because you can have the beautiful hospitals, but if there are no trained people out there, and no trained nurses and the doctors and the clinical staff, then of course those facilities are not really up to the mark and they're not able to deliver their services. Now, in a situation of disasters, with the increased pressure on these facilities, there is a human limitation for the health professionals to provide these services as well. So the correlationship between disasters and the health sector is extremely important. And once again, I would like to emphasize the timing for today's session is important, because what we are seeing right now is, especially because of the unique character of this particular flood, the water has really stayed on, especially in the province of Sindh. And it has been there for the last more than 6 weeks now, and it's receding at an extremely slow pace. So what there is a real natural health hazard, health hazard which is really coming up and being voiced up by many people, and especially the relief and the support agencies out there. And there are already reports which are basically saying that the people are already exposed and they are communicable, waterborne and other diseases. So this is going to bring a lot more pressure on the health sector as well. So this is the kind of a scenario in which we are. Well, I was kind of trying to understand myself for quite some time. So how the Pakistan health system is established, and what are the challenges which the system is facing. The system, I'm sure that you all know much better than me, that it has its own 3 layers: tertiary, secondary, and primary. And I think in terms of the accessibility and in terms of the spread out to the rural areas, that might be questionable. But I think at least when the system was designed, it was designed in consideration to the needs of the people to some extent. But what we know from practicalities, that it is not a completely public system. It's a hybrid system where a lot of gaps and deficiencies are being filled by a number of other actors, and they're doing phenomenal and a very good job actually when we're talking about the private sector contributors as well as philanthropic and civil society organizations, and they have actually chipped in. They came to the rescue of the people in terms of the providing. We see a lot of free clinics and free health services which are being provided. Some of the challenges which the system has already been facing, regardless of this disaster or the previous disaster, so some of the challenges which have become very endemic with the Pakistan health system, they are the system has not been able to upgrade, and not enough funding, the resources have been made available in response to the population growth and the pressures. There's a high concentration of communicable and non-communicable diseases, and some of the data which actually come from the ground is absolutely shocking, and some of the very kind of the diseases and the health challenges and the issues which have been successfully eradicated in many other parts of the world, and they're very prevalent and they're very common in the rural areas of Pakistan across the board. We know that there's a low health access and health inequities. So in the urban areas, there are opportunities and there are accessibility to the number of hospitals, and actually sometimes they are very closely situated to each other. But when we move away from the urban centers, the situation and the picture becomes quite serious in terms of the accessibility. Then there are vertical challenges, and then the financing constraints and availability of trained staff actually remains. So I think this is a kind of a background. This is a situation which has been prevailing in Pakistan for quite some time, and this demanded a large-scale funding as well as the other types of resources to be made available to the health sector, and which has not been done in the recent past. I'm not too sure, I haven't collected the numbers myself, but I'm not too sure what percentage of the budget of government of Pakistan actually goes to the health. But I can say that seeing the situation on the ground in some parts of the Pakistan, I can say that, and I'm talking with the people, there are financing and resource constraints which are being felt. Now, we have experienced two disasters, two very, very different from each other. COVID-19, and which we're just hardly walking out of it, and the other one is the flood right now, in which we're right now in the middle of it. I acknowledge and accept that these are two very, very different disasters. One is global health pandemic, the other one is uniquely Pakistan-focused, dominated, affected flood. The one is, there was this morning, there was some talks about it as well, and but there are some striking similarities between them as well, especially when you look into the health aspects of it. I think this might give us a kind of an opportunity to look into it and see that how well prepared and how well responsive our health systems are to any kind of disaster. Because as I said, that the health sector is this very frontline sector. It's always the very first one, and then I'll show some of the numbers in terms of some of the statistics as well, in terms of the needs as well. So it basically just to show that the kind of incapacity of our health sectors and our health systems for any kind of disaster. So flood 2022, which is still going on, and our health systems are still dealing and coping with it. But I think the COVID-19, which is not too far in the past, I think that left some important lessons for us as well. So in both cases, the large size of population affected, and the health emergency relief actually turned out to be one of the critical elements of relief and recovery efforts. What we have seen in both cases is the unbearable pressures on basic health infrastructure and health professionals. So, and this is, and similarly, the health inequities further aggravate the disaster relief efforts. One area which is very commonly missed out, and it's not actually really it's fleshed out, it's not highlighted in a much more forceful manner, is the mental health complications. So I think this basically tells, I think the one point which is to drive out from this is that inadequate health systems or the health infrastructure can have adverse impacts on a large scale, and it is correlated and combined with a number of other indirect impacts, for example, such as the mental health complications and a number of others as well. So when we're talking about the inequities or accessibility issues, and then the health sector not being able to provide the support in a timely manner, this of course erode the capacity of the population and life cycle of the population to deal with the trauma and the disaster of any of these calamities. So, what are the if we see from the floods 2022 and some of the determinants on the health sector impacts, and these are the numbers which have been corrected by UNICEF and under their WASH program. And these are quite interesting. So this basically tells us that what additional burden or what additional pressures this particular flood have brought to the health infrastructure in certain parts of the country. So there's additional 17% of the population, which actually amounts to around 5.4 million people, move from user protected to unprotected drinking water. So, and I don't think I need to really spend time and really elaborate that what is the relationship between the safe drinking water or protected drinking water to the health conditions, to the health impacts. Similarly, around 19% of the flood affected, which again amounts to 6.3 million people, have lost their household sanitation facilities, and because of the damages which came out because of damages of the health. Open defecation from 21% increased from 21% to 35% after the flood. Once again, approximately 4.5 million people, an additional 14% of affected persons are not practicing hand washing and other hygienical practices because the priorities have changed. And people are living in a very, very different scenario. So all these changes, all these changes in the behaviors, in a way, are the key determinants or the key components, which of course are going to have quite an impactful effect on the health sector. Now, if we combine this, if we read this with the previous slide, which basically the country has been suffering with the challenges in the health sector, and we see the additional burden and the pressures which is coming to the health sector, especially in a scenario, in a situation where the number of the facilities and the infrastructure is already destroyed, I think that becomes a very, very bleak picture, and that basically shows that this moving on and coming out.
We need to finish.
Okay, sorry. Sorry. Yeah. So this basically tells that this is not going to be an easy task to come out of it. Similarly, I was talking about it, the needs. So healthcare needs always stands on the top of the list, and this again, if you see that, and this is based on some immediate need assessment again done by the WASH people, and the healthcare is number 2 from the top, which is 59%. So there's a dramatic, what you see is a dramatic shift in the priorities of the people in the first period, from first to 1 to third month, and they do not really care about the education, housing, agri output, sanitation, or other items, but what they want, of course, the food, and soon after the food, people want and they care about the health care. So this basically shows the need for it. So the three main priorities in the post-disaster response, of course, one is the urgent delivery of life-saving and livelihood assistance, which is being done in its own limited capacity right now. The other one is the prevent outbreak of communicable diseases. I think this is the situation, this is the stage in which we are right now again, and there's a lot of emphasis on it to somehow avoid this health hazard. And the third one, of course, is the restore conditions for safety and living of affected people. I think the third task is going to be extremely important and equally difficult as well to accomplish. Now, this needs smart policy and program designs, and any smart policy and program design need to be fully integrated and comprehensive. It needs a design, policy, and implementation framework which is able to identify the need, diagnose the conditions, and then design the implementation mechanism of the programs with the implementation framework and mechanism which is very much built into it, and then have the capacity and this scope for the redefining of it, because one system, one mechanism, one program action is never going to work, and this needs a re-evaluation and reassessment on a continual basis. So this is a smart policy and a program design should look like. Again, looks a little bit of cumbersome, but I think this, the fundamental point in this slide is that it needs a constant and continual reassessment and redesigning component. A little bit about NDRMF, in particularly health, and this is the last slide. NDRMF is a government fund under the Ministry of Planning, and it has a mandate for disaster risk reduction across the board. Health is a key component of our disaster risk reduction areas, and we have a lot of actions and activities and interventions in a very typical and classical program, for example, flood control, early warning systems, but health has always been one of the key and core component of it. And the NMF provided a grant of 50 million during the COVID-19 pandemic for the procurement of the first of the vaccine and the PPEs. Very recently, we provided 1.6 billion rupees for the nationwide COVID-19 booster vaccine dose, and we are actually right now in the process of negotiating another emergency assistance funding for strengthening the basic and tertiary health system in Sindh, Punjab, KPK, and Balochistan. So this is, as you can see, that this very nicely sits into our core functions and the core mandate and areas of work. And we are actually bringing on board some health professionals in order to assist us and support us in this particular area. Thank you very much. Thank you.
I think I can be heard through this.
Yeah,
so the idea of avoiding redundancy by collaboration is great, and what we see, like Dr. Bilal talked about, that there is a way mitigation can be done. I think disaster after disaster, somebody comes and talks about how we need to prepare for the next disaster, and probably it's a disaster in itself that we're never able to prepare for it. Maybe we should be looking into factors why it happens, and how maybe we need to develop a philanthropic, collaborative crowd source that develops a model and then identifies area where each agency with their strengths can focus on that area. Because what happens in every disaster is people are looking up to someone else to provide them care. We are looking up to the state to provide care. The state itself is looking up to somewhere else. We know that the state is never able to provide for this. And like the redundancy in the field medical camps, philanthropic agencies just coming to fill that role. It's probably non-state elements that need to come up in terms of mitigation of disaster as well, because unfortunately state has failed to mitigate these disasters. So there's something that we need to collaborate and get forward and move towards.
Good.
Well, I think yes. So you basically raised two very, very important and interconnected points. One is mitigation of disasters. The other one is more specific and focus on the health sector. Mitigation of disasters, I think, we've gone past that stage number of factors, and by saying we, I don't have to mean we, the Pakistanis, but the global community is very much part and parcel of it, where the disasters cannot be eliminated. What we need to do is we need to prepare ourselves, plan ourselves to deal with those disasters, minimize the risk, disaster risk reduction, and come up with an interconnected and integrated approach, which basically includes a number of different instruments for dealing with disaster. So, if you mean mitigation by elimination, that is not possible. Adaptation is also not possible in the strict sense of the climate change induced disasters, but maybe for others, yes, we can. Now, when we say the health sector, or the health system, Dr. Wasi already mentioned about the need for coordination and integration, and I think no one can deny that. There is this kind of a very hybrid system, and the gaps are basically remained out of the public health system, which are filled by the private sector, large share, and then the rest coming from the public sector. Now, your point is interesting with the philanthropic kind of activities, and that need to be integrated and coordinated with these larger systems. But I think what we see is the charity and the philanthropic aspirations, they really fuel up whenever there is a disaster. So you cannot really have a system based on it. Yes, people are generous and they do come out and they do help people, and we all do that. But I think it's going to be extremely difficult to really make them part of the system. So that challenge is going to be there. I think the fundamental need is, as Dr. Wasi already mentioned, there is a need from the government to come up with a lot more spending on the health system. I think this is absolutely fundamental. And secondly is even the charities and the philanthropic and the civil society, they do not really reach out to the remote areas, and that still remains within the reach of the government to come up with the services. So I think coordination, integration, more collaboration among the different actors who are doing it. I think on top of everything is the government has to come up with the system, has to come up with the resources. There are minimum gaps and deficiencies that the other actors to fill out. So I think this is to me, this is the way to go.
We should conclude.
Thank you so much, Dr. Bilal and Dr. Wasi. We need to conclude our session. Thank you.